and I serve as the Chief of Addiction Psychiatry for the University of New Mexico. And I just wanted to talk to you all for a couple of minutes about the DATA Waiver trainings that we sponsor and provide that allows practitioners to get certified and qualified to prescribe buprenorphine to treat opioid use disorders. I think, as all of us are aware, our patients, our communities are grappling with the opioid epidemic and have been for a long time. And buprenorphine is an FDA-approved medication that is very effective for treatment of opioid use disorders. In fact, it's been shown that buprenorphine leads to a number of improved outcomes for our patients, including reduced mortality. In other words, buprenorphine saves lives. And yet there's a huge shortage of buprenorphine providers around the country, especially if you look at rural counties of the United States, right? And most of New Mexico is rural. And when you look at the rural counties, over half of all rural counties in the United States do not have a single provider that is able to prescribe buprenorphine. And millions of Americans are not able to access providers who are able to treat them with this potentially life-saving medication. Part of the reason is that per federal law, special training is required before one can prescribe buprenorphine. This is commonly known as the DATA Waiver training or the X Waiver training. So who's qualified for that training? Who can get qualified to prescribe buprenorphine? MDs, DOs, nurse practitioners, physician assistants, and now under the Support Act, clinical nurse specialists, CRNAs, nurse midwives are all also eligible to get trained to prescribe buprenorphine. But it requires the special training, the DATA Waiver training. And that's what we're talking about. We try to do at least one DATA Waiver training a month, done over an online virtual platform so you can attend and participate no matter where you are. How does the process go? There is no reading to be done prior to the training. You just simply sign up. We give you the link. You attend. It is important that you stay on for the duration. These trainings are generally scheduled for about 4 hours at a time. And we do ask that you keep the video on for our tracking purposes and also to improve interaction. Trainings just work better where I'm not talking for 4 hours straight and we're all having a conversation. So it's a 4-hour training that we do over a virtual platform such as this, where we go over history of opioids, buprenorphine's pharmacology, a little bit about psychosocial treatments. How do we treat special populations such as individuals with mental illness, pregnant women with opioid use disorders? How do we treat pain in individuals with opioid use disorders? We go over the nitty-gritty, the dosing of buprenorphine, the formulations of buprenorphine. How do we start it? The best practices, the essentials of prescribing buprenorphine. Again, it's a 4-hour course that you show up for, you complete it. After that, there is still 4 hours if you're an MD or DO that you need to do. Essentially, the way it works is once you complete the training, we send off the participant list to PCSS, which is the provider's clinical support system. They send you an email link, you click on the email link, and you complete the other training on your own. If you're a physician or a DO, that's about 4 hours, and you have 30 days to complete that training. If you are one of the other professions that I mentioned, then you still need to do another 20 hours of training, which is all, again, online that you can do at your own pace, and there are continuing education credits attached to it. We try to make the live part that we do very interactive, introduce the concepts, and really set you up for success with the other part of the training. That's really the idea. And then after you do the training, we're more than happy. In fact, we ask and look forward to working with you for ongoing support and mentoring through one of our ECHO programs so that we can really build up your confidence and skill levels. So that's really the nitty-gritty of what we'll be doing in this training. I will bring up that this website, pcssnow.org, is a very important tool. Go check it out. It tells you a little bit more about the training. It has lots of other resources, and also would bring up that the trainings that we do are sponsored by AAAP, which is the American Academy of Addiction Psychiatry. And the funding for these trainings is made possible, at least in part, by a grant from SAMHSA. So it's federally funded project, and the views that expressed in these conference materials or publications do not necessarily reflect the official policies of the Department of Health and Human Services, nor does mention of trade names, commercial practices, or organization imply endorsement. by US government. The idea is to really give you the best practices and the tools for you to be able to treat your patients more effectively. Thank you so much, and feel free to reach out to us if you have any further questions.